So we have about 10 minutes for questions. So the floor is open. I'll ask one while people are coming up. We've heard a lot about different partnerships, city department folks working together, Head Start and Medicaid, local level, child care. So if maybe each panelist could give us one accelerator that helps with enabling collaboration, and then one kind of barrier that and maybe how to address it. I don't know who wants to start.
Reiterate. There we go. I guess I'll just reiterate what I said during the talk. And the accelerator we had was the support of the First Lady's office. So anytime you have the backing of city government at a particularly poignant time in the evolution of someone's tenure as mayor or governor or president, you have a great advantage, and that truly accelerates things. And that's what I've, in all the time I've worked in early childhood, the thing that really seemed to drive activity was political will. As soon as you had the politicians really pushing for something, it seemed to work better. And again, the barriers, and I sort of joked about it earlier when I talked about collaboration. Collaboration is hard, and really breaking down silos and getting folks to leave their egos at the door and really accept a true partnership and a genuine partnership can be difficult, even among colleagues who like each other, who work well together. They still see often, I think, the pie as one size, and if someone else gets a bigger piece, your piece is going to be smaller. So I would say that's always a challenge.
I'd have to agree. Funding, right? Funding brings people to the table. It allows them to have conversations they wouldn't typically be able to have. And I will just say, in my 6 state partnerships, for the ones that don't have the political or powerful people pushing the issue, like in North Carolina and New York State, those are places where politicians and the community were both already in. And in the states where that wasn't a factor, it was money and technical assistance that was already sort of paving the way for people to have those conversations. In terms of barriers, I would say the unintended consequences of policies that we know need to happen, but that are perhaps unfunded.
I'm going to echo a lot of what they've said. We call them champions in our community. We identify who are children's champions and who will get behind something and move it forward. We've got a Mayor's Commission for Children in Springfield, and that is a group of folks who really care about young children and what happens to them. And so we've leveraged their talents and the fact that lots of them are not members of the choir, because it doesn't matter if I say it. It matters if the banker says it. It matters if the business leader says it. And then in terms of challenges, I think we've found great success in partnering when administration is committed to the goal. Where we struggle is when administration is committed, but we have not firmly articulated this shared vision downstream adequately to resolve the fear of competing priorities with the line staff who are doing the daily work.
Great. I would echo that the business community is an accelerator, can be a very important accelerator. If we don't have our business community engaged, then we're working on the periphery, and so we need to make sure that they become part of the fabric of our work. I would also say that a barrier would be that people do not typically tend to walk around remembering or knowing about the importance of the early years, that is the foundational time. And so there's this big educational component that needs to continue to happen so that people do understand that this is where we start and this is where we need to do our best work.
Great, thank you so much. Please, your name and question.
Hi, my name is Carrie Bateman. I'm from the New York City Department of Education. My background is in public health and disability, and I recently was the Chief of Staff for Special Education and have joined the Division of Early Childhood. So I just wanted to further build on Dr. Askew's data and mention that in New York City we have 270,000 students with disabilities. That's about 21%. Nationally, it's at 13%. Wow. So I wanted to note a gap in the intersection between health and education, so we talk about it as it pertains to disability.
Thank you. Thank you. Terry?
Terry Allen from the Cuyahoga County Board of Health in Greater Cleveland and a member of the roundtable. This is for my fellow Clevelander, Dr. Askew. Go Tribe, go Cleveland Indians. 21 in a row, just saying. I thought from the public health standpoint, governmental public health standpoint, your point about the early intervention amendments to your health code was really interesting in terms of the spread and scale opportunity nationally as related to oral health and some health eating, active living provisions, just the ones you mentioned. But I think that from a policy standpoint, I'm also very interested in the assurance mechanisms that you've put in place. I get concerned sometimes that many of us, present company included, you are paper tigers with our health code language, but what can we do to assure that indeed the language is carried out to have the impact intended?
No, that's something that we consider very strongly, and in fact, there's a lot of things that we'd like to do and that we'd like to put into the health code, but one of our first questions is, what's our ability to enforce it? What's our ability to make sure it happens? So anything that goes into the health code, we assure that we have some ability to track that it actually gets done and that it gets accomplished. In this case, we have actually our child care health and safety folks are in our environmental health division, and they actually do regular visits and inspections and sort of check off the things that folks should be doing as part of the health code. So it will be, again, once it's in place, it will be enforced.
Thank you, David.
Yeah, Dave Kindig, University of Wisconsin, and member of the roundtable. A comment and a question. In the beginning of thinking about this workshop, you know, the roundtable, I mean, we are aware, like those of us at Pop Health, we've sort of now discovered early childhood and as a social determinant of health and how important it is. But in the talking about it, I mean, we don't have the expertise. The people that we're hearing for, like in this panel around the room, do. Maybe the place that we can play the role is finding ways in which the healthcare system and public health can essentially help you achieve your goals, like these shocking resource gaps that Krista just showed us, and I'm sure we're going to hear more about that later. And then there's a sort of co-benefit from that. So that's the comment, and I hope during the day we can learn more about how we might support your field in your efforts to the benefit of both. The question is a narrower one, but in that vein, in a collaborative vein, I don't know if there's any evidence, and I'd be interested in our experience, about the degree to which hospitals that are required, nonprofit hospitals that are required to do community benefit as a benefit of their tax-exempt status, whether there are any dollars or how much dollars are going into this field in achieving that federal requirement to essentially deal with some of the resource gaps that you mentioned, and that we'll probably hear more about later.
So I know that they are happening anecdotally. I'm excited to hear if anybody else knows of specific instances, but I know that that has been a part of the conversation and part of some targeted things, and I certainly know that, especially in states like North Carolina, where health insurance is already so heavily involved, like Blue Cross Blue Shield as a system is involved, but I know that it's part of the conversation.
I just know of a number of different children's hospitals that are focused on this. You know, we are at Nemours, Atlanta Children's Hospital, Cincinnati Children's Hospital. A number of the children's hospitals are involved in terms of a direct, I mean, tally. I don't know that answer, and I'm not sure the panel does either.
Well, I'm going to actually address the earlier part of what you said.
Yes.
Particularly since I have my colleague Josh Sharfstein in the audience, because we had a conversation, I don't know, it was a couple months ago, he may not even remember it, but we were talking about health and the idea of social determinants of health and how important they are, and how as a health body, we actually don't control the social determinants of health. So it's it's incumbent upon us to partner with folks in housing and parks and housing, parks, the Department of Education, other things that we know are social determinants, because again, we know how important it is to health outcomes, but we don't necessarily control those things.
Because we're standing between you all and lunch, and we're over our time a little bit, I guess Larry was the one person I saw standing up. Why don't you take the last question, Larry?
Real quick question again, Larry, from the Forum for Youth Investment. George, probably for you, but it might apply to the others. A lot of the conversation, and I agree with it, is external collaboration. New York City Health Department, mental health is a huge organization. Can you just mention briefly how you try and do cross-sector within such a large organization so that the rest of you know what's going on?
I'll use the example of early childhood, particularly because when I came on, one of the things that Dr. Bassett wanted to do was, again, sort of focus on early childhood, but the early childhood activity was happening in multiple areas within the health department. What we've tried to do, we can't control and do all of the work that's going on in early childhood, and we don't want to try to do that, but what we're trying to do is spend more time having meetings that are bringing all the early childhood health and development people into the same room just to share what everyone is doing and make sure that we don't, we're not stumbling over each other with our work, that we're not going after the same grants from external partners, that we're not duplicating the same campaigns. And sadly, it still happens all too often because, again, these are long-standing silos that take a while to break down, but know that we're giving it a shot, but it's difficult.
Good. Great. Well, with that, let me really thank the entire panel. Thank you so much. Great panel. A few announcements for the folks who are members and presenters. There is lunch in the Murphy Room, the place we had breakfast, and there's a list of some other neighborhood options that are available to attendees at the registration desk or in the attendee packet. We're going to start at 1:20 with the gallery walk, and that's going to be in that room we were in before. And then Larry's going to come up and do the summary of that. And just on behalf of the transcriber, when people come up to the mic, could you please say your name and your organization? It would just really help a lot. So we'll see you back in the Berman Hall at 1:20. Thank you, everybody.